don't go to work. They don't go to work. They don't go to work. They don't get food. They don't go to work. They don't get food. They don't go to work. Good morning, good afternoon, good evening, wherever you may be. This is Feroz Manji from Daraja Press. Welcome to Perspectives on Organizing in the Time of COVID. Today, my guests come from Seoul in Korea. We have two very interesting people who will be talking to us, Dr. Saerom KIM and Professor Chang-yup KIM, about how Korea is dealing with the COVID-19 pandemic. Dr. Saerom is a director of Gender and Health Research Center at the People's Health Institute in Korea. The focus of the research area is participation, empowerment, gender, and power in health-related decision-making. Saerom has been working as a communications coordinator at the People's Health Movement in Korea. Professor Chang-yup is professor of health policy at the School of Public Health, Seoul National University, and president and director of the People's Health Institute. Also, he has been the country coordinator of the PHM Korea, People's Health Movement. His current research includes health and social policy, equity and social justice in health, health reform, and critical health studies. He is a founding president of the Korean Society for Equity in Health and the former president of the Academy for Critical Health Policy, Korea Society for Global Health, and Korea Society for Health Policy and Administration. A warm welcome to both of you. Thank you for joining us. Professor Kim, I think your sound needs to be turned on. You are still muted. Okay, great. Welcome to the show, and thank you for sparing time to join us. Perhaps we could start with you, Professor Chang-yup, to say what's your assessment of the situation of COVID pandemic in Korea? Is it the success story that so many people refer to, or do you have reservations about that?
Okay, it's very challenging question. That first of all, I would like to comment on how we can say that some event, such as in this case of COVID-19, that how we could define some event as a successful or failed. Especially in this case of a pandemic, there are so many discussion about the performances and the action of the government or some academics or the civil society organization, that how we can behave. There are so many criteria or some aspect how we do have some behaviors or some responses. As in terms of some confirmed cases, I mean the patients confirmed, or some number of tests, or some performance of tracings. Maybe the Korean performances could be assessed as successful, or some fatality or some number of mortalities compared to other countries. Maybe our performances could be successful. But in details, or if we can have a look at the processes or some in detailed activities and some step of responses, especially some when we have some very many patients in the southern part of our country. In that cases, we could have some excess mortalities or some the misbehaviors and the poor responses to many patients because of our healthcare systems could not operate properly. So I mean that according to the different aspect of our assessment or the evaluation, we can say very different things regarding the success or failure. So we have to have some more contextualized approaches in having some assessment, depending on its context or depending on if the system or cultural aspect or the behavioral aspect. We have to have very different approaches to say about our success story. My personal assessment so far is that partially we could have good record, but in details we have many things to improve, especially from the aspect of from people's perspective. And some people have actually they received some poor quality healthcare, or some people have the unnecessary infection, and some people have very unnecessary suffering from the containment or the violation of privacies. Some people have low quality of healthcare because of not good arrangement of healthcare services. Actually, many professionals in public health arenas or the healthcare service provisions have some very confusion and some unnecessary workload or burden in providing some services to the patients and some resident at the local levels. So comparatively, especially from the global comparative perspectives, Korean record could be successful, but in terms of our own responsibilities or our own the improvement in our public health and healthcare system, there are the huge spaces to be the improved. So also the point of view is that it's a kind of sometimes globally overall performances could be presented as in the national averages, national overviews. But the South Korea is also compared to Canada or the United States or India is very small countries, but our features of the overall infection, overall the spread of COVID-19 is very different according to different localities. So from the locality perspective, some grassroots perspective, the success or failure could be a very different story. Some localities, some local areas, responses overall is very poor. Really? Compared to the professional criteria or some people's perspectives, whatever. So my main message to our performance is that we have to define more clearly that what is success. why did it fail? Not from the professional views or not from the government viewpoint. My argument is that the success or failure have to be decided from the people's perspective, not from the government or not from the professionals, not from the international comparisons.
Yeah.
Okay.
I think what would be helpful to hear from either of you is more specifically what has been the strategy for dealing with the pandemic. I mean, let me give you an example. Where I come from in Kenya, the approach has been to militarize the streets. The police are put on the streets. In fact, more people are killed by the police than are killed by COVID, certainly amongst the people in the ghettos. And there is a curfew at night, which, under the idea, I guess, that, COVID doesn't transmit during the night. So, I mean, that has been the sort of approach of the Kenya government. And it's true in South Africa. It's true in a number of other countries as well. I think it would be helpful for people watching the show to get an idea of what were the core elements of the strategy that was implemented in Korea. I don't know whether, Saerom, you'd like to take that on?
Okay, as you know, many of the audiences of this show already know that the responses, so social responses as a whole, actually is the very complicated combination of so many factors, including the historical one and social one, very cultural one, including the governmental action or reactions from the civil societies and everything. In our cases, I think one of the main factors to determine our overall responses has been that our experiences in MERS 5 years ago is another pandemic, but for Korean peoples, it was very serious experience and very strong, the strong legacies still remained in every people's memory.
Right.
Okay, actually, nurses at that time is very newcomers to many Koreans. Or it can be the first experience for many Koreans that it is, even though it's very hospital-based infection, it's very serious, but it could damage so many things in the societies. So actively very painful experience of the MERS. Government as well as the patients and peoples and so many civil societies. It's very social learning that in case of this kind of infection, we have to cope with some very systematic responses with the very good leadership of the government. The cooperation and the commitment of the citizens is very essential in coping with these kind of communities or hospital-based infection. I think the first most important factors to determine the current behaviors of the ordinary citizens would be very social learning or the experiences from relatively short time. And another interpretation of me is that it's a kind of the another kind of legacy that the until relatively recent time, the Korean the Korea is the relatively authoritarian regime. So culturally and socially, we are a little familiar with that authoritarian culture. That especially in case of the this kind of infection, that the main actors, the role has been played by the government, and so every people had to comply to the guideline, even though it was not mandatory. It's not the not similar to some countries, such as not mandatory confinement or the lockdown, but every people's. My opinion is every people are so familiar with the kind of very unitary, very the responses to each kind of maybe the East Asian culture that we have to comply, even though it is not mandatory, not by the rule, but in case of the infection, this kind of contagious event, we have to very comply. Third factors, I mean, it's a kind of very interesting paradox that even though the authoritarian cultures still we have, but my interpretation is that it's a kind of a neoliberal cultures. So because of if we are infected, actually we can be fired. Also, if we lose our job, we have to survive. We have to be survived by ourselves.
So the victim is blamed. It's
blamed, and not only blamed culturally or socially, but we have to lose our economic actually the capabilities, losing jobs, and in case of precarious jobs, our income could be cut down.
Right.
So every people have to be very, very protective by themselves.
Right.
And we can rely on the governmental support. We can rely on the professional advice.
Right.
And we have to be survived by ourselves. That even if we compare to the authoritarian legacy, this kind of the neoliberal mentality is very interesting. But so many people, I have to be prevented by ourselves for ourselves.
Right.
That's the basic mentality and milieu. So I am so surprised that when I have taken all the actually the subway train,
Yes.
100% have some mask.
Are wearing masks. Okay.
Yeah, wearing mask. So surprised that with passing time, each the getting more and more cultural, and such a very authoritarian culture that everyone have to wear the mask.
Right.
So, but very basically the motivation or the origin of their behaviors, I have no scientific evidences, but my assumption is that it has been derived from our neoliberal culture that there is no alternative for me
Right.
to do my own best to be free from this infection.
Right. Well, let's bring Saerom, please. Your perspective on that, and I'm particularly interested for you to help us understand who are the most affected and why. What's the social background of that?
Well, Actually, I think your question that who is mostly infected is really hard to say because compared to other countries who even have more huge amount of confirmed cases, Korea government gives us a few basic information of those people who are infected, but it is not really evaluated that who are infected and what was their socioeconomic classes or what were they doing during they were contacting the virus. So I cannot say for sure, but first of all, mostly infected people in Korea is in Daegu area, which there was a huge cluster infection. But actually there is like 15,000 people confirmed and around 300 person who died of the COVID-19. So I cannot really say who was infected, but mostly I believe that those people who were staying at the nurseries or who were staying in the hospitals, which were kind of low qualified, were mostly infected without protection of the government or protection of the hospitals. And well, there I do want to reveal some kind of this health inequalities among those COVID-19 infected people. But what I can say is that Korea has a relatively high rate of women infection, and the mostly infected people are from this religious group who was initially found to be infected in the cluster infection, which are more than like 4,000 people there. So
sorry, this religious group you're talking about, can you explain for us who you're talking about?
The people of the cluster infections, you mean?
Yes, you said there's a religious group.
Well, there was this group named Shincheonji, which was somewhat what did I say? Well, actually, this was really coincidental.
English translation is the new heaven and earth.
Okay.
Yeah, new heaven and earth, a group of people. And I do think this is related with extensive social inequality in Korea because this group is really unique and they stay together. They meet like more than 7 times a week and they are really protective of themselves. And they hide that they belong to that religious group because they have to propagate their agenda without being stigmatized. So this group had this huge, more than 2,000 people gathering in one ceremony in a huge building. So big cluster infection was found there. So it was the first epidemic peak where Korea government have found that kind of COVID-19 infection. It was like February 21st when it was first revealed. So there was a lot of crisis going on in that province in Korea, but it was a kind of controlled now. But they tend to have really low income people with low social capital and low reputation. So they tend to work in low wage jobs such as care worker or some nursing jobs or some kind of service jobs. So they spread the virus through with their work of propagation. So this was a really cultural thing that even Korean people had not expected.
Right, but it's similar, isn't it, not to the patterns that we are seeing internationally, that it is those who are working in the lowest paid jobs, who are under conditions usually where they're constantly exposed to the virus. It's health workers, it's nurses, it's doctors who are being affected. Is that the same pattern that you are seeing in Korea?
Well, yeah, I agree. But after that kind of epidemic of Shincheonji, well, it's like 40 to 70 people in fact confirmed every day, and there was a few group infections where the women's and low wages workers work, like some kind of call center outbreak, or some mental health facilities, which was full of disabled patients or the elderly patients. So I think this pattern is really similar with other countries, like even Europe or Canada.
Yeah. I mean, your speciality is working on the issues of gender, and one of the things that has emerged in a number of countries is reports of a growth in domestic violence as a result of confinement and so on. Is that something that you are witnessing in Korea?
Actually, many women researchers and feminists are really keen on the issue, but unfortunately, gender-based violence is not actually well monitored in Korea. So, with this kind of social distancing measure, the government ordered the NGO and the institutes which deal with the gender-based violence to close their workplaces and just take the calls by the phone. So there was a little evidence that even the number of calls were reduced after the COVID-19. This is really saddening thing, but we believe that there would be more gender violence like other countries, but it was not really evaluated yet or actually monitored really appropriately.
And so your work on relation to gender and health, what are the issues that you are dealing with?
When I wrote the piece about the gender aspect of COVID-19 in Korea, I tried to explain every step of gender inequality which emerges in every decision-making areas, because actually Korea does not have this kind of gender mainstream approach in public health crisis, because it's not really something that Korean government's Ministry of Health does not even have the gender health or women's health department yet. So they do not have any gender lens during the pandemic. So I tried to emphasize that you have to think of the gender hierarchy in every step of the responses. So, it was something that something to make them see that, for example, the most powerful decision maker in the COVID-19 response were, of course, the political leaders who were the governors of every local district. There is 17 local districts in Korea, and in last election, all of the 17 governors were male in Korea. Well, there was a little story that 3 of them was accused of sexual exploitation, so they are not working right now. But so this means that every decision making was made by the males, and in the case of healthcare management and the responses, it was mostly filled with male doctors or male professionals or male public servants who was usually dealing with the important stuff in everyday life. So this was repeated again. So now in the People's Health Institute, we are doing a research on healthcare workers who dealt with the COVID-19 crisis. And those are more than 80% of those are women, and they are kept saying that even though they had this message that they had this opinion about the response measure, they had no space to engage in engage, or they had no opportunity to opportunity to deliver their voices in the decision making of every organization or the local government.
So is there a strong women's movement in Korea? Is that one of the?
Well, there is this young feminist, a movement of young feminists, but as you can see in many current movements, they are not very well organized. They usually work in the SNS or in the internet, and they do appear in a demonstration, but their power is not supporting the arguments of current feminist agenda of gender mainstreaming in the healthcare policy or mainstream institutional areas. So it's not really connected.
Right. Both of you are active members of the People's Health Movement, which is an international movement. Professor Chang-yup, perhaps you could say something about what are the policies of the People's Health Movement in relation to the COVID crisis? What are the demands being made, not just in Korea, but beyond? You need to turn your, okay, great.
Unfortunately, I have not so much information regarding the PHM's global policies, but to my understanding that maybe everybody is feeling that the so-called the global governance or the global cooperation is not functioning in the in face of the COVID-19 pandemic. So first of all, actually the global action have to be focused on how we could reconstruct, or actually it's not reconstruction, it's the construction. How we could construct some global cooperation because it is a pandemic, and also in case of low and middle income countries. So many low and middle income countries is suffering from the lack of resources, and it also seems the social economic impact by the overall responses to pandemic. So my personal understanding is that first responsibility of the PHM is how we could rebuild or initially build the global cooperation, not in a separated, not in a very silo style reaction responses by individual countries, but the incorporation with the other countries, especially in case of the vaccine or some actual some resources, logistics or the pharmaceuticals or some essential medicine. So the personal equipment. So it's very essential to have some very integrated responses by global actors, especially in the resource-constrained countries. So one of the highlighted issue is the vaccine and pharmaceuticals around the patent, the IP rights. So that's the basic steps the PHM are taking at the moment. That is my understanding.
And Saerom, what's your perspective on what the People's Health Movement are doing and what they should be doing?
Well, actually, well, I'm sorry that the actively communicating people whose son is not here, but I have been involved in people in the People's Health Movement asking for their opinion on their situation, or making some kind of global signing for advocating work. So actually, as I'm kind of new in this kind of global movement. So this gives me another opportunity to think about the same issue in another context, in another political condition. So I think it's really helpful for the young generation of researchers and activists to learn from each other. But actually, it's really hard and not really active in Korea, which have this kind of movement in the global level. So
right. Well, finally, I mean, what would be your main message to people who are watching here in terms of what have you learned in terms of dealing with the situation in Korea? What are the lessons that we might learn from your experiences? Start with you, Saerom.
Actually, we had not much chance to discuss about the good things that Korean government has done, or some kind of positive experience we had experienced. But if I say this briefly, I think South Korea was really lucky because we kind of had this chance to control the infection before it became widespread in the community. And we had this experience of MERS that every people was really keen on their self-protection and self-sanitation through the period. So I think people's active engagement in response to the COVID-19, and this was again the experience from the MERS, which was that government's message of transparent message, which makes people believe in what the government say to people, was really important, because in the 5 years ago, the MERS epidemic, the government kind of hid some information from the people, which made another epidemic. So this was really criticized by the civic society. And civic society learned that we have to expose and remember and 기록하다. We have to keep saying that people are excluded, some people are excluded, or some people are not protected, that people could see, and then government could see those people who are not protected and do the action. So I think the transparency and the active engagement of the people and the CSOs were really important in Korea.
Oh, great. I think it's a very important message. Professor Kim Chang-yup, what would be your message?
Actually, this pandemic is the global scale pandemic. I think 100 years after after Spanish flu, that my lesson from this event in my country is that actually the COVID-19 is not only the issue of public health or medicine or the biological, also the issue of the social. My emphasis is given to the social. The social is more important than the biological or the medical. I mean that actually the the method of responses at the moment globally is that so-called social distancing or the personal prevention. Actually, those things is it's very included in the social, not the medical or not the biological. And so, in case of the school opening, the professionals or the government has a very limited knowledge how we can reopen the school. And every knowledge, so most of knowledge and most of our judgment have to be dependent on actually school members, including the students or the parents and the teachers and workers. I mean that the COVID-19 is the issue of the how we can develop some democratic decision making. It's not only for the aftermath consequences of the COVID-19, but response itself is very related to the issue of democratic decision making in every area of our societies. So I mean that, of course, I'm sure that there is very strong mental block that actually COVID-19 is a disease or pandemic infections. So it's the duty or obligation of the professionals of the government. But actually, it is the issue of the democracy. So if we suppose this pandemic is not ended in a few months, that we have to decide our action and our new social arrangement and new the way of responses. So everything is related to the issue of our revival or our development of democratic decision making. So I think this pandemic is a very huge opportunity for everybody, including the Korean people, that how we relate this pandemic to the social democratic decision making, or the development of more democratic regime, including some responses to pandemic.
Well, those are both two really important messages because they are, in a sense, the same. The involvement of people, the organizing of people, and the issue of democracy. This is not merely a medical problem. It's above all a social and a political issue that needs to be addressed. I think those are very powerful messages to be shared with all of us. I want to thank both of you for sparing time today. So late at night for you, but thank you so much for your time and for your contribution to this this ongoing discussion. Thank you for that.
Thank you.
Thank you for inviting us.
And I hope we can keep in touch, and we will be in touch again to learn more about how things are progressing.
Okay, thank you.
Okay, thank you.
Have a nice day.
And you. Thank you very much for joining us here on that discussion on COVID-19, perspectives on dealing with the pandemic from the perspective of the experience of Korea. Thank you for joining us. This is Firoz Manji from Daraja Press, saying thank you for joining us here on Perspectives on Organizing in the Time of COVID. Good night for now, and we will be online again soon.
They don't go to work. They don't go to work. They don't get food. They don't go to work. They don't get food. They don't